Understanding the superior mesenteric vein and stenting. The superior mesenteric vein, or SMV, is a crucial blood vessel. It carries blood away from the small intestine. This blood then flows to the liver. A blockage in the SMV can cause serious health problems. A superior mesenteric vein stent is a small metal tube. It helps to restore blood flow in the SMV. This minimally invasive procedure can significantly improve a patient's quality of life. SMV stenting is necessary for several conditions. These include blood clots, known as deep vein thrombosis or DVT, tumor compression, and narrowing of the vein, called stenosis. The procedure is usually performed by an interventional radiologist. They are experts in using imaging techniques to guide minimally invasive procedures. Diagnosing the need for an SMV stent involves a comprehensive assessment. The process begins with a thorough medical history review. This includes any symptoms the patient is experiencing. Physical examination helps to identify any visible signs. Imaging tests are crucial for visualizing the SMV and detecting blockages. Ultrasound is often the initial imaging test. It uses sound waves to create images of the vein. Computed tomography or CT scans provide more detailed cross-sectional images. These scans help to determine the location and extent of the blockage. Magnetic resonance imaging, or MRI, may also be used. This technique is particularly useful for assessing blood flow. Careful preparation is essential for a successful SMV stent procedure. Patients typically receive detailed instructions. These instructions include fasting for a certain period before the procedure. Intravenous fluids help maintain hydration. The patient is usually given a mild sedative. This helps them relax during the procedure. A team of healthcare professionals works together to ensure patient safety. The team includes an interventional radiologist, nurses, and anesthesiologists. The anesthesiologist monitors the patient's vital signs throughout the procedure. They also administer medications as needed. Informed consent is crucial. This ensures the patient understands the procedure's risks and benefits. The medical team answers any questions the patient may have. Open communication between the patient and the healthcare team is vital for a positive experience. The SMV stent procedure begins with gaining access to the vein. This is done through a minimally invasive approach. The interventional radiologist typically accesses the vein through the femoral vein in the groin. Alternatively, they may use the jugular vein in the neck. Local anesthesia numbs the area where the catheter will be inserted. Using imaging guidance, the interventional radiologist carefully inserts a needle into the chosen vein. A guide wire is then threaded through the needle. This guide wire acts as a track for the catheter. The catheter is a thin, flexible tube. It is carefully advanced through the blood vessels, guided by the guide wire. Real-time imaging, such as fluoroscopy, helps the interventional radiologist visualize the catheter's movement. This ensures it reaches the precise location of the blockage in the SMV. Section 5. Precise stent placement, restoring blood flow with imaging guidance. Once the catheter reaches the blockage in the SMV, the stent deployment begins. The stent is a small, expandable metal mesh tube. It comes compressed around a balloon catheter. This catheter is positioned within the narrowed segment of the SMV. Under imaging guidance, the balloon is inflated. This expands the stent and pushes the blockage outward against the vein walls. This restores the normal diameter of the SMV. Blood can then flow freely through the vein. The interventional radiologist carefully checks the stent's position using imaging techniques. This ensures it is correctly placed and fully expanded. Once the stent is deemed satisfactory, the balloon catheter is deflated and removed. The guide wire and introducer sheath are also removed. Section 6. Immediate post-procedure care, monitoring for complications. After the SMV stent placement, patients are moved to a recovery area. They are closely monitored for any immediate complications. Vital signs such as heart rate, blood pressure, and oxygen levels are checked regularly. The puncture site is inspected for bleeding or swelling. Patients typically stay in the recovery area for a few hours. The medical team provides pain medication and ensures the patient is comfortable. They also monitor for signs of infection, allergic reactions, or other complications. Before discharge, patients receive detailed instructions on post-procedure care. This includes information on wound care, activity restrictions, and follow-up appointments. Patients are encouraged to contact their healthcare provider immediately if they experience any unusual symptoms. Section 7. Long-term management, anticoagulation, and follow-up appointments. Long-term management after SMV stent placement often includes anticoagulation therapy. This involves taking blood-thinning medications to prevent clot formation. The duration of anticoagulation therapy varies depending on the individual patient and the underlying cause of the blockage. Regular follow-up appointments are crucial to monitor the stent's patency and the patient's overall health. During these appointments, the physician assesses the patient's symptoms and reviews any medications. Imaging tests may be performed to evaluate the stent's function. Lifestyle modifications may also be recommended to promote vascular health. These may include maintaining a healthy weight, engaging in regular exercise, and quitting smoking. By adhering to the recommended treatment plan and making healthy lifestyle choices, patients can optimize their long-term outcomes after SMV stent placement. Section 8. Benefits of SMV stenting. Relieving symptoms and improving quality of life. SMV stenting offers numerous benefits for patients with blocked or narrowed superior mesenteric veins. One of the most significant advantages is the relief of symptoms. The procedure effectively restores blood flow, alleviating symptoms such as abdominal pain, nausea, vomiting, and weight loss. By improving blood circulation in the digestive system, SMV stenting enhances nutrient absorption. This is crucial for maintaining overall health and well-being. Patients often experience increased energy levels and improved quality of life. SMV stenting is a minimally invasive procedure. This means it involves smaller incisions, less pain, and a faster recovery compared to open surgery. It also reduces the risk of complications associated with traditional surgical interventions. Section 9. Potential risks and complications. Addressing concerns and providing reassurance. While generally safe and effective, SMV stenting, like any medical procedure, carries potential risks and complications. These are typically rare, but it's essential for patients to be aware of them. Some potential complications include bleeding, infection, allergic reactions, and stent migration. In rare cases, the stent may not fully resolve the blockage or a new blockage may develop. This may necessitate additional interventions. Patients should discuss their concerns and any pre-existing medical conditions with their healthcare provider before the procedure. The interventional radiologist will thoroughly explain the risks and benefits of the procedure. They will answer any questions the patient may have. Open communication and a clear understanding of the procedure can help alleviate anxiety and ensure a positive patient experience. Section 10. Advancements in SMV stent technology, enhancing outcomes and patient comfort. The field of interventional radiology is constantly evolving, with ongoing advancements in SMV stent technology. These advancements focus on improving stent design, materials, and delivery systems. The aim is to enhance procedural success rates, reduce complication risks, and improve patient outcomes. Newer stents are designed to be more flexible and resistant to kinking or fracture. This is crucial for ensuring long-term stent patency and minimizing the need for repeat interventions. Biodegradable stents are also being explored. These stents would dissolve over time, eliminating the need for a permanent implant. Advances in imaging guidance systems allow for more precise stent placement and real-time monitoring during the procedure. This enhances accuracy and improves patient safety. These technological innovations continue to drive progress in the field of SMV stenting, offering patients safer and more effective treatment options. Section 11. Conclusion. A team approach to successful SMV stent insertion. Inserting a superior mesenteric vein stent is a complex procedure. It requires a skilled and experienced interventional radiology team. Collaboration among healthcare professionals is crucial. This includes nurses, anesthesiologists, and technicians. Each member plays a vital role in ensuring patient safety and positive outcomes. Following a strict protocol is paramount, from diagnosis and patient preparation to stent placement and post-procedure care. Every step is critical. Meticulous attention to detail and adherence to established guidelines minimize risks and optimize patient well-being. SMV stenting is a valuable tool for treating blockages in the superior mesenteric vein. By restoring blood flow, the procedure relieves symptoms, improves quality of life, and enhances overall health. As technology continues to advance, we can anticipate even safer, more effective, and patient-centered approaches to SMV stent insertion in the future.